So, firstly, let us start by understanding what induction of labour means. To induce labour means to make your labour start when your body was previously showing no signs of going into labour spontaneously. It's a way to bring an end to your pregnancy. There is no doubt that in a few cases, this will be a life-saving treatment for women and their babies. But we are all now aware that far too many women and their babies are being induced, and that this previously considered helpful intervention is in many cases now causing more harm than good. With any intervention comes risk. In fact, according to the World Health Organization recommendations in 2011, almost 1 in 4 women are having their labours induced. So why might you be offered induction of labour? Well, either you or your baby may be poorly, and this may be the best option for you both, given your current health. Other reasons given may be high blood pressure, preeclampsia, diabetes, cholestasis, a growth-restricted baby, reduced fetal movements, prolonged pre-rupture of membranes, or prolonged pregnancy. Now, before we get into any detail, I need to make something very clear. Women and their birth partners are often told by their care teams that they will have to be induced by a certain time or date, or that they will only be allowed to remain pregnant for a certain number of weeks. This is not true. Whatever happens or is happening in your pregnancy, you still have human rights in birth. It's always your choice whether to accept or decline the advice you have been given to have your labour induced. No one can force you to have a medical procedure that you do not wish to have, and no one can force you to go to a hospital should you not wish to. They will always need your informed consent. And the word informed here is very important. As I say to my clients, when we change birth, birth will change. Induction of labour needs to be an informed and well-discussed decision, and you need to understand how an induced labour differs from a spontaneous labour, because they will be different in how they feel, the options that you will have, and the way you will be cared for. Are there times when induction is not recommended? Yes. Breech babies, babies with severe growth problems, a history of fast labours, a suspected large baby, or babies that are premature. Is induction sometimes offered where there is little evidence to prove that it's the best way forward? Yes. Twins and multiple births. We simply don't have enough evidence to prove whether induction will be beneficial or not. Induction after assisted fertility treatment. Again, although those who have used IVF or another fertility treatment are often told that they should be induced to avoid post-term birth, we actually have no evidence which can tell us whether an induction a week or 2 earlier than spontaneous labour would make any difference to an IVF baby. You may be told that your risk of stillbirth doubles if you decide not to be induced by 42 weeks, or, depending upon where you are globally, earlier than this. Now, what studies do show is that even if there is an increase in stillbirth rates beyond 42 weeks of pregnancy, this is still rare. Probably about 2 in 1,000 ongoing pregnancies, compared with 1 to 1.5 in 1,000 pregnancies, which are ongoing at 40 weeks. So not wholly inaccurate, but when I say doubled, that language makes it feel or seem like a great deal more, doesn't it? Interestingly, a population study done in the UK in 1999 reported that though the risk of stillbirth was at its lowest at 42 weeks and rose slightly after that, beyond 42 weeks it was no higher than it was at 37 or 38 weeks. And clearly, we are not offering induction of labour as standard at 37 weeks of pregnancy. So although many women are being told of rising rates of stillbirth, should they choose not to be induced at 40 to 42 weeks of pregnancy, it's important to remember that although stillbirth does happen, it does so far later than we are led to believe, and occurs far less often than we are led to believe. There are also many reasons why a baby may not survive to birth. This is devastating to all those involved, but we may never know exactly why it occurred. So what does induction look like? Well, your labour can be induced chemically using a prostaglandin gel or a drip of synthetic oxytocin, or it can be induced mechanically using a stretch and sweep, which is often offered to avoid induction of labour, even though it actually is an induction of labour, a Foley catheter, or artificial rupture of your membranes. Clearly, in this short video, I can give you no more than an introduction to induction of labour and the many arguments that surround it. However, it's so important that you gain a solid overview and understanding of what this will mean for your birth. The books that I would love for you to have in your shopping basket or ready to download to your Kindle are Dr. Sara Wickham, Inducing Labour, Making Informed Decisions. Rachel Reed, Why Induction Matters, and The AIMS Guide to Induction of Labour. The websites I will be linking you to in the text below this video will be those of Dr. Sara Wickham and Rachel Reed's Midwife Thinking. I will also be posting the link to a superb article on the subject of the myth of the ageing placenta by Sophie Messenger. Always remember individualization and risk. So even in the risk factors that I mentioned earlier, you can be asking, how high is my blood pressure? Is my diabetes controlled? If you have cholestasis, what are your bile acid levels? How small is your baby? What is the pattern of movement for your baby? And what is your normal menstrual cycle like? When do you ovulate? Or when did your mother give birth to you? And read up and learn about your subject. As with all things in life, if you don't know your options, you won't have any. Induction of labour is a huge subject and not one to be taken lightly.